I'm Dr. Shravan Hungyo, Chief Medical Officer, Kamjong District. Kamjong District at present has one community health center, two PACs. At present, we have 8 doctors, allopathy doctors posted here in the whole district, and 6 ayush doctors posted. We have since May we have been keeping this. We have these quarantine centers, 20 of them in number, and from May we have started taking in the passengers who come from outside the state of Manipur. First, we started at Kasom Kulen PAC. Then, at present, we have altogether out of the patients in the quarantine center, 19 of them tested positive. Of these 19, 3 of them were kept at the institutional quarantine at Imphal East, and the rest were kept in the Kamjong district itself. The positive patients of the positive cases were after testing them, if they test positive, they were taken to RIMS, the isolation ward, for further treatment. Most of the patients are asymptomatic, and only a few of them were symptomatic. Only 1 or 2 were symptomatic, but the rest were symptomatic.
It's really good that the recovered patient have surpassed the active cases, right? But there are also some reports that those inmates, those who stay at the quarantine, if they after completing 14 days, when they move back to the community, some of them have got tested positive. So is there any such instance from Kamjong district?
So far, we don't have such case, but one was discharged, but on the same day itself he got the result. He was discharged, but he got the result and he was taken to the Yunako care center, COVID care center. So far, we don't have.
In such kind of situation, you don't have to do contact tracing.
We have done some contact tracing because last time from Ukrul, one girl was discharged to Sorbung village community quarantine center, and then she tested positive after being discharged in the community quarantine center, and we took her to RIMS. Now she has recovered.
So you have a you don't have a proper hospital, right now?
We don't have district hospital. We have only CAC, PAC.
So what are the challenges you are facing right now?
The challenge we are facing right now at present is the shortage of doctors in the district, because as there are only 8 of them, allopathy doctors, and 6 ayush doctors, it's very difficult to maintain the quarantine centers also. There are so many quarantine centers in a small quarantine center, means the bed available is not much. In one of these 20, some have 167 bed capacity, some have only 20, like that. So we have many quarantine centers, but we can't post all the doctors there, because the number of quarantine center exceeds the number of doctors, and we have to take samples also from the community quarantine center, which are there in the village, some sort of mobility team. We go there also and take sample. So it's very difficult for us to maintain both. Samples also are taken by these allopathy doctors and the lab technicians. So as there are shortage of doctors, we can't it takes very much effort for them. For a doctor, for one person to collect some 100 samples is very difficult. These are the challenges we are facing, and going from one place to another, as it is a hill terrain, communication is very bad. The roads are bad also. So when we go also, we face problems going from one place to another. And our district is such that Kamjong district headquarters is not at the center. Phungyer is there, Kasom Kulen is there, but we have to pass through Kasom Kulen. We have first to go down to the valley, Imphal, and from there we have to go again to Kasom Kulen. So we are facing these problems.
Okay, myself, Dr. Rangla James, MO in charge, CSC Kamjong. I have been MO in charge for past 1 year, and then this is the first time that I posted after getting through this one as a medical officer in Manipur Health Services. I joined CSC Kamjong since 2019 of February, 1st of February. And then since then, I could see there is meager changes, but there is not like, there's lots of space or to improve a lot, you know, because as the state has declared this Kamjong as a district, so we need proper infrastructure, building, and the manpower and everything. So there is so many lacking behind. So we are trying hard with our CMO that to bring in many more manpower so that we can run these institutions in such a way that people, how we can, the coverage is very much, like there are so many villages, more than 50, 56 around, we have covered this under this Kamjong block. So the population will be around 30 plus we are covering. So we have only few doctors. Imagine like we have 3 allopathy, and then 1 ayush doctor, and then 1 is dental doctor. So you imagine how we can handle so many. As if you take the ratio, no, it will be how much. Imagine.
So how are you managing it?
That's the thing that that's a good question actually. How we manage this CHC. Now this the pandemic time, the COVID time is more difficult, you know. And the other time we can manage. We have some sort of not much patients. Some like some emergency sometimes becomes like some road accident, and then delivery cases, and then mostly we are dealing with the OPD patient actually. So this time so many influx from the other state, meaning the returnees coming from different states. We are dealing with now already 500 plus. I mean like 500 total, 508 something around already here, and then minus some discharge also there are 200 something, 282 around. So right now at present I think roughly around 150, 200 something around they're here plus. So the challenges is huge, I could say. In the beginning, like I call all my team, like, you know, all my colleague and then the staff, so that how to handle, to take care of all the themselves also. It's very much necessary that the frontline workers should be very much, it's a very much at high risk, so they should be taking care of themselves, how to like donning, doffing, those things we are teaching to my staff, so that they may be aware of how to handle of themselves when situations is emergency, something like arise in between. That's how we are dealing. And then in the beginning it's a little tough. Now we have 7 quarantine center in this CSC, under CSC Kamjong, institutional quarantine center. So going to other place here and there, it's not like in one place quarantine center. You know how the road condition, sometimes this is the rainy season, so many rains and raining, and then it's tough. And then we have only one vehicle, 102 and a national ambulance service. That has been since 2015. Imagine like the condition of the, it's not been like servicing for long. You know, this for 5 years, only 1 or twice I heard from our driver. So I request if the authority, the health authority, concerned authority to look into this matter, and then so that we can have the at least one ambulance or bolero or something, whatever, for transportation. Actually, with this ambulance we are using for, before we used to go for this transportation of the serious patient, mainly this one road accident, emergency cases, and then pregnant lady, and then 1 year old or below, these sick infants. So we used to carry, but now because of this corona, we are not able to, it's difficult for us to manage those patients if in case if it comes. So actually we are carrying the samples after collection with this ambulance. So how can we like go and then with the rigs we can carry all those patients? So it's a big issue, big problem for us.
So are you getting enough support from other support groups, pressure groups like, you know, CSOs or student organization here?
Actually, yeah, the volunteer, this one, we have a COVID forum also, and then they're helpful. They're helping us a lot in many ways, I could say. And then in the beginning, little bit tough when the starting time, but usually, gradually, we used to have understand each other, and then becoming friends, and then the volunteer, and then it's now we are able to manage somehow. Like they're so much helpful. I should say that I'm thank you for all the volunteers in under CIC IQC, Kamjong IQC, for their helping hand in everything. When patient comes, they know what to do. They have their own responsibility. We don't need to tell them. So they have they are very much responsible. Yeah, in the beginning, actually we received passenger from outside. The first passenger from Chennai actually came on 14th of May afternoon. So that time, because of the traveling so much, they're tired. The patients are tired, and then they want that the volunteer to carry their things. So they're very much upset about because we are not able to help them, because we are not actually to do also. That's how we are telling the other people, our staff, and then the volunteer, not to carry their, no matter how much they are bringing their stuff, let them do their self. Okay, that's how we are telling them. That's the difficult part. It's that the volunteer, sometimes, the drivers, they wanted to go here and there, something, straight away, they don't want to go back. And some problem happened because of all those things. So they mingle with some other local people, and then some problem started. So that should not be, maybe because of the awareness among this area that has not been properly penetrated to the people. That's
Has it changed now?
yeah, there's a lot of change. Because of that, so many, we also involved. I myself went to that place whom they have been mingling, and then they have been so we started telling them that this is not good, and then we started telling them not to go outside, the kind of containment that area, no? So we make that, and then those involved in that activities, we just send to a quarantine center, institutional quarantine center. And then after that, I think people through MIPE also, and then the local people, the volunteer, they're announcing, and then those things, I think it have a lot now, changes a lot. So the mindset of in the beginning and then now is totally different. Because last time from this institutional quarantine center, 8 positive from this Kamjong block. So all are asymptomatic. And then people thought that, if quarantine, this one coronavirus means everything is over. So it's not like that. So people should understand, they should, very much aware that this coronavirus can be cured, not without much proper treatment. Actually, we don't have this proper cured that medicine till now, but actually gradually it can be you can develop your own immunity by eating good, healthy, stay healthy. And then that's how that's happening in Manipur right now, that people are gradually recovering after 2-3 days when they went from this place in isolation rooms. That's a good thing. And then I should say that no one to be panicked at this moment. You have to be in emergency means there is nothing emergency like that. No? There is a saying that emergency means there is nothing emergency. In the sense I should be protected first, It's not like someone is having fever and then the sick, I have to run. That's not emergency. So you should be protective yourself. You have to cover up yourself, whatever equipment you have. That should be the first for the front line, and that should be applied for everyone. Not only the front line also, but the volunteers and all the people here. So no need to panic. That's, I should say, from my side, that we are here. If anything is needed, they can call up me, and then everyone knows. And then if anything to be done, we'll do together, and then we can defeat this pandemic. Yeah, this is very much needed from the beginning. When I came, I saw it should not be this because the building itself, as you entered, the ceiling is already rotten. So this should be yeah, repaired as soon as possible. That, and then the other thing is like the manpower. That is the most important thing. When you may be having a good you know, good equipment, or you may be having good building, but if you don't have like doctors, nurse properly, then that's going to be like useless, no? So we need doctors, more of doctors, so that we can like we can do lots of things. When you're in numbers, we can do so many things. Like, you know, actually we need some specialist doctors also. We don't have any specialist doctor right now. We have only MBBS doctor, so that is not good. And then actually CIC should have medicine, physician, surgeon, gynae, anesthetist, everything. We should have proper OT, but all those things we don't have because of the we don't have this one specialist doctor. And gradually, if once the specialist doctor come, then we can introduce like OT and proper OT, proper lab, everything we can change a lot. So only infrastructure is not good. The infrastructure wise, we have X-ray, but because of no technician, it's been like, you know, it's just like that. It's
So if
already
X-ray to be done, what did you do? Did you send them?
actually, yeah, we have to send to either the nearest will be Okrul District Hospital, or other like Lai Shifung and other thing. No? They have, but here as this one going to be district hospital, we don't have that lab technicians. I think this is desperately needed, one lab technician.
In case of emergency, how do you handle the thing?
Yeah, those in such cases, like we did whatever we could, no matter what serious it is, but sometimes we lost on the way, because it's you have to travel to at least 2 to 3 hours to the nearest better this one infrastructure hospital. That will be this one district hospital Okrul, and then going to Imphal will more take time, like at least 4 or 5 hours it will be. So you imagine, like, if you don't have proper transportation, and then if patient is very sick, then obviously on the way you'll die gradually. So that's we are facing. Sometimes it's very much, we are very feeling very sorry to say that it's happening every time when serious patients comes.